Hey guys, if you ever wake up one morning feeling strangely tired, your skin looks dull, your energy is flat, and your desire feels like it's quietly leaving the room, don't rush to blame age, work, or late-night screens. The truth is, in many men, the earliest stage of HIV can silently pull down your hormones, your drive, and your overall health long before you ever think to test for it. According to the latest CDC 2025 update, based on 2023 U.S. data, there were about 38.8 to 39,000 new HIV diagnoses. Over 80% were men, and about two-thirds came from male-to-male transmission. Most were aged 25 to 44, and the southern states still lead the numbers. Thankfully, 82.8% began treatment within 1 month, proof that early awareness saves time and life. I'm Dr. James, your physician-scientist friend with more than 20 years of real clinical experience in urology and HIV prevention. In the next few minutes, I'll help you. 1. Understand how early HIV disrupts your hormones and desire. 2. Spot the hidden body signals most men overlook. And 3. Learn a 60-second nightly ritual to regain control. If any of this hits home, subscribe now and drop a 1 in the comments so I know you're walking this road with me toward 1,000 men who choose awareness. And stay until the end, because I'll reveal one powerful secret that lets you get ahead of symptoms, boost immunity, and stay confident, even if your partner shows early warning signs. Now, before we act, let's understand what's really happening inside your body. Guys, understanding is the first step out of fear, and I want you to grasp the core mechanics quickly, so we can act with calm, not panic, because clarity turns worry into decisions and gives your body steadier leadership. Your immune system and your hormones constantly talk, and in the earliest phase of HIV, the immune fire turns up. Cytokines rise, stress nudges cortisol upward, the HPG axis wobbles, free testosterone can drift lower, REM sleep thins, and brief erectile hiccups start appearing. Picture your hormones as a clean amplifier and inflammation as background static. The music, your desire, energy, and morning confidence is still there, but the hiss grows louder, and what you hear is not silence, it is your favorite song trying to push through noise. Early hints are not diagnoses, yet they are useful when they repeat across days. Unexplained fatigue, clammy night sweats, restless or shallow sleep, a quiet drop in desire, slower gym recovery, and a sharper sensitivity to stress, caffeine, arguments, or late screens that steal REM. Anxiety can amplify the loop. Worry elevates cortisol, elevated cortisol fragments, ERM, poor EREM, downshifts hormone rhythm, the HPG axis mistimes testosterone release, and the result feels like a mind that is wired while the body is flat, with a desire dial drifting low. Meet Peter, 28, desk job, long hours. For 3 weeks he has noticed less desire, choppy sleep, damp nightshirts, and a noon crash after coffee, blaming deadlines while stress turns up static and shortens the restorative REM window. Here is the simple frame I want you to hold as your physician-scientist friend, Dr. James. Immune heat up, cortisol up, HPG wobble, testosterone drift, REM thin, desire dim. Name the chain, stop arguing, and start measuring what is real. Track that chain and you will spot timing patterns. Midnight scrolling, weekend drinking, or late workouts, because cortisol spikes and REM depth hinge on timing, and those levers move hormones towards stability, resilience, and steadier confidence over the next several consistent weeks for you. If you hear your own story in Peter's, do not look away, because the next segment reveals the root causes men miss, including stress timing, sleep debt, low-motion workdays, and skin-level irritation that quietly drains the system until desire and motivation feel muffled. If this section brings clarity, subscribe and comment ready for the weekly checklist and the 60-second nightly ritual, and then stay with me as I map 3 to 4 hidden roots that push hormones downward. Do not stop here. What you are about to hear is critical, and if you grasp these root causes, you will stand ahead of most men, because clarity beats fear and turns reaction into control. Root cause number 1: stress and high cortisol. When work piles up, or when you worry after a suspected exposure, cortisol stays elevated, the HPG axis suppresses, REM, sleep thins, and hormones misfire. The result is flatter desire, edgy nights, and brief erections that shake confidence. Root cause number 2: REM sleep loss. Late nights and blue light disrupt melatonin timing, blunt the normal morning testosterone rise, and steal the neurological reset that steadies mood and libido. Your body wakes up, but your mind is jet-lagged, and desire feels far. Root cause number 3: too much sitting and too little movement. Long chair hours reduce pelvic blood flow, stiffen hips and lower back, and sap erection quality. Many men report a dry engine feeling, as if the system turns over, yet lubrication refuses to appear. Root cause number 4: background inflammation at skin and mucosa. Recurrent irritation, minor STIs, or UTI-like burning with negative cultures keep immunity simmering. Fatigue rises, sensitivity spreads, and the constant alert quietly knocks on the door of desire, focus, and motivation. Peter's progression. Peter works late, drinks coffee after dinner, and sits more than 10 hours daily. After one unprotected encounter, he felt restless, his stress loop tightened, and within weeks his sleep fragmented, his desire dipped, and mornings felt heavy, unrefreshed. Reality check and community cue. If you recognize yourself in these roots, say yes in the comments, because your note helps me gauge where you are and helps other men feel seen, while we keep walking forward together. The trap that sends many men off course is not on this checklist. The hazard hides in the body's blind spots where signals are quiet and timing is tricky, until misses accumulate and confidence fades when you need it most. We understand the roots, so you and I will move to the body's blind zones, and we will learn where to look and how to look. So key signs are not missed, and your next decisions rest on evidence, not adrenaline. Guys, this part is about you, the blind zones most men ignore. These blind zones look ordinary at first, so you dismiss them, and in the next 60 seconds I will make them unmistakable. Start with the 2 control towers, the HPG axis, the brain, pituitary, and testes, and the HPA stress axis. When immune heat and life stress push HPA harder, cortisol rises, HPG timing slips, testosterone pulses wobble, and desire feels like a radio drifting off station. Scan the first physical cluster, the groin lymph nodes. If one small node sits there beyond 4 weeks, even without pain, flag it. Add night sweats and a fine, sandpapery rash that comes and goes, and the pattern becomes harder to wave away. Scan the sleep cluster. Short, shallow REM, a delayed bedtime, and a higher resting heart rate on waking. If your smartwatch shows a morning bump you cannot explain, connect the dots because sleep architecture and hormone rhythm travel together on the same beat. Picture an oxidized electrical joint. The current, your drive, is really present, yet the resistance rises at the connection. The signal crosses, but the warmth, clarity, and fullness drop, and within weeks you call it burnout, even though the body has been tapping your shoulder. If you ignore these pockets, background inflammation stretches on, cortisol loops stay high, and the downward trio, libido, energy, and focus, slides together. The longer you rationalize, the more your confidence erodes, and dread begins to shadow intimacy. Peter's check-in makes this real. He feels a small groin node, notices sweaty nights, and watches his sleep splinter. He shrugs. Probably a cold. Yet the pattern repeats, and the oxidized joint metaphor fits. Nothing is broken, but the connection is dirty. If this helps, like the video, and if you need more clarity or have questions, drop them below and I will jump in. So, what can you do tonight to lower that resistance? If you are with me, stay locked in, because the next section delivers the decisive move. I will teach you a 60-second ritual, simple to do, powerful enough to turn the trend. Congratulations on getting here. Now grab a pen right now today, because the next 60 seconds could become the simplest upgrade in your routine, and if anything is unclear, write in the comments. Name of the ritual: See Sense Scan plus 60 6th to 3. We will keep it practical and calm, because clarity becomes action when steps are short and specific, giving you steadier sleep and a path your confidence can stand on. C. Detens. Face a mirror and check skin and mucosa quickly. Look for redness, cracks, or unusual discharge, and mark anything new, because a 30-second log beats a 30-day worry spiral, and patterns over a week matter more than any single snapshot. Sense. Detens. Pause and listen to your body. Note heart rate, warm flushes, head tension, and sweat bursts. Then rate stress 1 to 5, because naming the number lowers noise and the brain settles faster when feelings are labeled with a simple scale. Scan. 20s. Gently feel the groin, lymph nodes. Record size, tenderness, and firmness, and flag those that persist beyond 4 weeks. We care about trends, not scares, because timing shapes meaning as your baseline emerges and quiet signals become easier to read. Breathe 4, 4, 6. 20s. Inhale 4, hold 4, exhale 6. Let your exhale length cue the parasympathetic brake, because the extended out-breath signals a shift from threat to restoration, which prepares REM sleep to handle the hormonal housekeeping your system needs. The 60-6-3 rule. Within 60 minutes of a concerning exposure, journal details and call a clinic to assess PEP within 72 hours. Do not self-medicate. At 6 weeks, schedule a 4th-generation egg or AB test. At 3 months, repeat 4th generation plus RNA if recommended. Mechanical protection. Use condoms and a water-based lubricant to reduce friction and micro tears. Recovery habits. Take a warm shower, pat dry, moisturize high-friction skin, and protect bedtime. Lights out before 11, because circadian timing steadies mood and testosterone rhythm. Peter tonight. He logs a pea-sized node, practices the 4-4-6 rhythm, and books an early consultation. He chooses steady steps over endless scrolling because written plans beat catastrophizing when your body needs calm leadership. As promised, here is the secret you waited for. Put plus. 3-layer confidence. means undetectable equals untransmittable, achieved by consistent ART that drives viral load below detection. When maintained, sexual transmission does not occur, which becomes a shield replacing fear. 3 layers: accurate knowledge, understand you, correct technique, condom, lube, and skincare, correct schedule, the 60-6-3 timeline. My promise: if you practice the 60-second ritual nightly, follow 60-6-3, and hold these 3 layers, stress will ease and sleep will improve. Your sense of control and desire will steadily return, acknowledging that personal results depend on adherence and clinical guidance. Disclaimer: this is educational content, not medical advice. PEP, PrEP, and ART must be evaluated and prescribed by your clinician. If this helped, comment "helpful" or ask for specifics, and I will show up. Now, I will prove why this works with clear evidence, so your next steps rest on science and your confidence grows from understanding, not guessing. Guys, I know you still feel a bit skeptical, and you should. Healthy doubt protects you from hype. Let me earn trust with biology you can use. When you breathe 4 to 4 to 6, Your long exhale nudges the parasympathetic brake and lowers cortisol. Less cortisol removes pressure from the HPG axis, so testosterone signaling steadies, REM sleep deepens, and desire stops gasping and begins to breathe again. Sleep timing is hormone timing. When you guard bedtime and extend REM, your morning testosterone peak becomes sharper, night sweats often ease, and daytime energy returns. Nightly brain housekeeping clears inflammatory noise, and mood regains the steadiness intimacy needs. Condom plus water-based lube is more than safety talk. Reduced friction means fewer micro-tears, fewer open doors, and less local inflammation. That combination protects skin, preserves sensation, and keeps immune system from burning fuel on preventable repairs. The 60-6-3 schedule puts you in the right place at the right time. Within 60 minutes after concerning exposure, journaling details and contacting care support's rapid PP assessment within 72 hours. At 6 weeks, fourth-generation testing finds early answers. At 3 months, repeat testing confirms direction. Undetectable equals untransmittable is modern, strong science. When antiretroviral therapy drives viral load below detection and you maintain it, sexual transmission does not occur. For men, that truth reduces fear, lowers stress chemistry, and makes protection and testing easier to sustain. 2-week snapshot, Peter. After practicing the nightly ritual and protecting sleep, his night sweats decreased, his mornings felt clearer, and he followed the 60-6-3 timeline. When his clinician determined risk warranted it, PEP was evaluated, and follow-up testing stayed on schedule. If this makes sense, drop a heart to tell me you're with me, and get ready, because the next section shows the ripple effect you can feel across your whole body: energy, focus, mood, and confidence. We will map benefits you can notice day by day, so your progress stops guessing and starts measuring real change. Guys, listen to me clearly. I will not promise a rose-colored world, but tangible gains appear, and they build quietly, because biology rewards consistency more than intensity. Mind and body begin to sync. You startle less at night, mornings feel sharper, and workouts become regular again, just repeatable, because energy stabilizes when sleep, hormones, and nerves stop fighting. Skin and mucosa calm down. With condom plus water-based lube and simple skin care, irritation fades, chafing eases, and confidence in intimacy rises, because comfort signals safety, and the brain stops flooding you with doubt. Work performance lifts. Focus returns, fog thins, and tasks stop feeling sticky because sleep architecture improves, cortisol steadies, and attention can stay on one thing long enough to finish. Relationship dynamics mature. You lead conversations about barriers, testing timelines, and you. And fear steps back because facts plus rituals create trust, giving partners room to breathe. Think of it like tuning an EQ. The bass, sleep, comes back warm, the mids, hormones, balance, and the highs, focus, brighten, so the whole track stops distorting and your day plays clean. Weeks 3 to 4, Peter locks bedtime, walks after work, and speaks about barriers and tests, because honesty beats rumination and movement beats spirals. What does all this build in a man's character? If you believe this matters most, comment Jung, so I can shape the next segment to your expectations. Now, we move to the return of confidence and identity. Keep going, gentlemen. The best gains arrive when you stay on the path. Guys, let me share what I've been seeing after 1 to 2 months together. Your eyes look lighter, your shoulders settle, and your voice carries air, as if the body trusts the plan. You reconnect where you felt cut off. You understand your body, you follow a simple roadmap, and panic no longer drives the wheel, because routine replaces rumination and facts outrun fear when nightly rituals anchor the weak. Your masculinity returns to its right pitch. Desire is not exaggerated or missing. It is responsive and respectful of boundaries, because confidence grows from calm control, not from pressure or performance. Partnerships soften. When you are steady, your partner gets steady, and conversations shift from guessing to choosing, because safety and timing are shared, and you knowledge lowers the temperature. Think of it as your body's second spring, quiet, warm, and durable. Peter puts it simply, "I've stopped running after fear. I get ahead with the 60-second ritual and the 60-6-3 schedule. If this feels lighter, give me a sign. I want you to carry 5 lines home. We will summarize and invite action tonight. I'm truly grateful you stayed to the end, because every view fuels more human, evidence-based content, and your presence tells me this conversation matters. Thank you for choosing clarity over fear and for giving your body the leadership it deserves. Here are 5 lines to carry home tonight. Simple and memorable so you can act when routines wobble and your confidence needs a plan that fits real life. Early HIV can noise up hormones, pulling down desire and energy. Your blind spots are groin nodes, night sweats, REM sleep, and circadian rhythm. The 60-second ritual plus 60-6-3 clears noise and times your testing. Mechanical protection, condom, water-based lube, gentle skin care, prevents micro-injury. You. When viral load is undetectable, sexual transmission does not occur. This restores freedom and reduces fear, as affirmed by CDC and global consensus. Tonight, run the 60-second ritual and write a single journal line, because tiny, repeatable actions beat vague intentions when stress is loud and sleep is fragile. If you're ready to get ahead of symptoms, comment "I'm in," and I'll deliver a compressed checklist in the next video, focused on timing, tools, and weekly milestones that make progress visible. If you want a couples version, with conversation scripts, barrier plans, and a shared testing calendar, comment "pair." When we reach 200 comments, I'll publish it and pin it. Please subscribe if this helped you or a friend breathe easier today, because steady knowledge is a gift you can pass on with a single click. Education only. If you suspect exposure, contact CARE promptly for PEP assessment within 72 hours and follow clinician-guided testing. Your body is not betraying you. It is inviting you back to control. One steady step at a time.